say again, you are watching Talking About. I'm John Griffith.
I'm Salvatore Capizzi.
And we are joined by a couple of familiar faces. We're going to call this show, we're kind of the PrEP squad.
So you're definitely wearing the right color, of like the Truvada pill.
So, well, introduce yourself to the audience.
I'm Damon L. Jacobs. I'm a licensed marriage family therapist in Manhattan, and also do a lot of work around PrEP, which is called pre-exposure prophylaxis, advocacy, education, activism, and awareness.
And Scott?
And I'm Scott Kramer, and I do a lot of HIV social work. I'm a psychotherapist, licensed clinical social worker in Manhattan. I run groups and I see individuals, and I really work a lot in the HIV community. And I try to build community, and I try to make sure that people are not isolated, and that they can really have a place where they can be safe.
On Sundays. This man works on Sundays.
Sunday mornings.
He is so invested in the wellness of our community. He works Sundays to help people socialize and get therapy and feel good and have something meaningful in their lives.
Absolutely.
So.
Okay. Well, we're all about PrEP today. So for those who don't know, and for those who haven't seen the shows that we've done prior to this, what is PrEP?
Well, okay, so PrEP stands for pre-exposure prophylaxis. This is a daily medicine that is called Truvada that a person who is HIV negative would take in order to stay HIV negative in case they would be in case they might be exposed to HIV virus at some point in their lives. That's the short version. Now, of course, that's fraught with social issues, political issues, financial issues, social norms, sex negative fear, targeting, stigma. We can get into all of that, but that's the basis.
Well, you just covered the entire concept of the show. Thank you.
See you later. Let's go build a wall. Sorry.
And I do want to remind the audience that we are live and we are accepting any questions, comments, feedback. Say what you mean, just don't say it mean. We're at 718-460-9802. Please feel free to call in and interject. Just be nice about it.
So, although the technical term is pre-exposure prophylaxis, it's an acronym that's used in the scientific community and it's accurate. But I like to think of PrEP as standing for something else. For PrEP stands for something else. It stands for proactive, responsible, empowered pleasure. Let me say that again. Proactive, responsible, empowered pleasure. It is proactive because it is something that someone does ahead of time. It is not done in the heat of the moment, when our minds are not necessarily in the most rational place, right at the moment where you're about to have intercourse with another person, and those condoms sometimes don't always get used. PrEP is something one does in a consistent, mindful, often sober, rational state ahead of time. It is responsible because when I choose to take PrEP daily, which I've now been doing for 4 years and 4 days, it is not just something, I'm not just saying that HIV ends with me. I'm also saying that HIV ends with the partners who I choose to be with. Most people in the United States who are currently transmitting HIV are individuals infected with HIV who do not know their status. And so when someone chooses to maintain their HIV negative status in a very proactive way, they're not only just preventing it for themselves, they're preventing it in their communities. And then it's empowered because it is the first time that my HIV status hasn't been contingent on somebody else's choices. And if I can just say, and this is Queen, so I know that we're all involved and we're all, we could just say it here. If I am the receptive partner in anal sex, or otherwise known as the bottom, it has always been up to somebody else to the top to wear the condom and make sure it didn't fall off or fall in or somehow magically disappear, as condoms sometimes do. That was always giving somebody else the power to determine my health. Now, using PrEP, I am fully empowered with my sexual health, with my HIV status, and for myself and for many people using PrEP, that has also translated into other areas where we feel more control, more sense of agency in our lives. And finally, the last P stands for pleasure. Because what are we talking about here? We're talking about sex, we're talking about anal sex, we're talking about sex for pleasure. Now, I say that because a lot of times when we have these conversations, well, not when you and I have these conversations, but when activists or educators or scientists come together and they talk about prevention, they somehow leave out the word pleasure in all of that. And I think we have to ask this question seriously. Why do we still have 50,000 new infections in the United States? Why do we still have 2 million infections worldwide? People are having sex for pleasure. They're having sex to feel
How dare
good.
they? How dare they?
How dare
But to connect sexually, physically, spiritually with another person. And most of the time, most men and women are not using condoms in those interactions. So instead of judging that or stigmatizing that or shaming that, what if we were just open about the fact people want to have sex for pleasure and they want to have more sex with less consequences? PrEP allows someone who's negative to make the decisions that are right for them in terms of how they are connecting with sexual partners or maybe one sexual partner. But it is a very different paradigm shift from what we've known from most of the last 30 years of prevention.
Okay, that's quite the mouthful.
That's the intro. Well, it's the first time I've heard it. Hopefully not the last.
We'll talk about that later.
A mouthful.
That's a mouthful. It's been known to happen, John. Just saying. He's a stand-up comedian. I'm a kneel-down comedian.
I'm losing control of this conversation.
You've lost
Okay, well, it is one way to empower people, and a lot of the feedback on the con side that I've heard is fairly easily shot down. You know, what about side effects? What about inconsistencies? And what about long-term studies? And my feeling on the subject is these types of decisions should be made hand in hand with your doctor.
Oh.
Just so that you can monitor, because they might be rare side effects, but they sometimes happen.
Absolutely.
And you should be monitored by a physician just to make sure that everything is working as it should be. That's my feeling on the subject, and that's usually how I counter that argument.
That's great. Well, you've got the FDA, the CDC, and the World Health Organization behind you saying the same thing. Absolutely.
And there's a specific protocol for PrEP.
There
right?
is.
Yeah.
Well, there are guidelines. So doctors don't have to follow those guidelines, but the Center for Disease Control definitely outlines the correct guidelines for doctors to most responsibly and appropriately prescribe PrEP. And that includes quarterly screenings to see if there's any changes in renal functioning or kidney functioning to make sure that those side effects are not occurring.
Okay.
And if they are occurring, in every case where this has been seen, and as you pointed out, it's very rare, but in every trial, in every real-world setting, when there have been changes in renal functioning and a doctor has seen it early, the person has stopped Truvada and their renal functioning went back to normal. So there has been no irreversible side effects done from using Truvada as PrEP.
Okay.
So far. Now, again,
Under close supervision of
under a
physician,
doctor,
yes.
following CDC guidelines, following that protocol, quarterly screenings.
I'm sure it's out there. Or in the forums where you have discussions on the subject, have you found any doctors resistant to this? And
Oh yes.
and how do you educate the doctor without? I love my doctor in every way. Hypothetic. I'm on it. He or she is not supportive of PrEP per se, but I've bonded with this doctor over the last God knows how many years, and this is where I want to protect myself. How do you educate the doctor?
Well, first of all, I would love to meet the doctor, and maybe next time we'll do a show where we can have a little back and forth about that. My approach to speaking with doctors, and fortunately I've been able to do some really, really great trainings throughout the state of New York now with different medical providers who are ambivalent and a little bit resistant to this idea. What they tend to say is, if I were to prescribe PrEP for my at-risk patient, I'm afraid then he or she will have sex without condoms. And what I say is, like, you just got cause and effect reversed. Most people, especially men, gay and bisexual men under 30, and I'm talking about CDC stats here, they've already given up condoms, or at least consistent use of condoms. According to the CDC study by Dr. Don Smith, most gay and bisexual men were not using condoms back in 2000. So I know, as being a provider, as being an educator now since the early 90s, that people weren't using condoms back then either. So why we think that a condoms only, all or nothing approach to prevention is going to work better in 2015 than it did back in 1985 is a little beyond me. But what I do is just get back to the facts with the doctors. Your gay and bisexual patients who are coming to you asking for PrEP have already, for the most part, consistently given up condoms. And they're coming to you because they want help. And if they are at risk for HIV, they're going to be on Truvada anyway. And if they're HIV positive, they're probably going to be using Truvada in combination with other meds for the rest of their life. So why not consider Truvada as a prevention strategy while they are HIV negative, while they may not need to use it every day for the rest of their life. And what I mean by that is because someone who is HIV negative and at risk for HIV is probably not going to be at risk of HIV for the rest of their entire lives. They may get involved in a primary relationship with a monogamous partner who is either also HIV negative or who is HIV positive and undetectable. And we can talk about that in a minute, because I just came back from Vancouver and got a whole bunch of new stuff about that.
Right. Because I'm going to be directing that at you.
If they're in a primary monogamous relationship with an undetectable partner, they may not even need to be on PrEP. So I would say to any doctor who's resistant to this idea, if someone is coming to you at risk for HIV, you're going to be prescribing them Truvada eventually anyway. Why not do it as a negative person instead of as an HIV positive person? And if the person is amenable to a conversation like that, I would also review the CDC guidelines, the World Health Organization endorsement, the Human Rights Campaign recommendations, all of these large medical and political organizations saying somebody at risk for HIV has the right to use PrEP if they want to stay HIV negative. And they have the right to come to a doctor and get support in doing that.
I want to, Sal, you're the representative of the 20-somethings on this stage right now.
Oh boy.
Well, do you find that there is a discussion amongst your peers about PrEP at all?
I feel like people my age in their 20s are using PrEP for the exact reasons why you said not to be using PrEP. It's completely just the go all out, we don't need to use condoms type of approach. That's what I kind of take in from people that I know of you are on it and of using it. And to me, that's kind of like inappropriate. Like PrEP is, I mean, the way people my age have talked about it with me, it's just a freedom to be careless. But like you said, it should be used as an extra precaution, not as the end-all be-all.
I did not say that.
Oh.
I did not say that.
That's what you heard.
Could use that.
Yes. Yes,
that
yes.
I did not say that people should use it that way. I don't believe in shoulds. And I don't believe in telling people what they should do with their body, because I have no right to do that.
Sure.
I would ask you or ask your friends, well, what were they doing before PrEP? Because most men your age aren't using condoms, period. Not everybody, but most. And if that wasn't true, we wouldn't still have 50,000 new infections in this country. We would not have seen a rise in new infections by 132.5% in men between the ages of 13 to 24, but between the years of 2001 and 2011. So if everybody was using condoms already, we wouldn't even be sitting here having this discussion. It's not that you've got the cause and effect switched. Gay and bisexual men have already stopped using condoms. PrEP is an opportunity to stay negative. And I think the reason why you're hearing more about it now is because PrEP is giving a lot of us the empowerment to talk about this, because we're not ashamed anymore. And we're not going to be ashamed of claiming our desire with our friends, with our community, and talk openly about condomless intimacy the way we were shamed into doing before PrEP.
Right. Is PrEP an all across the board way to prevent HIV, or are there certain strains that are resistant to it? And if so, what are the percentage of those strains? Like what, because Truvada is currently the only medication you could take for PrEP. Is there a certain percentage that doctors are seeing that completely bypasses this medication, or does it end with Truvada?
That's a really great question, and that has been studied, and it is being studied. What we know so far is that there has not been, in any trial setting or any demonstration, which is a real-world implementation setting, there has not been a single HIV infection amongst participants who use PrEP 4 or more times a week. 4 or more times a week. Now, I just got back from Vancouver. I got back from a scientific conference where there were a lot of results of these demonstration projects that were presented. We already know the results of some of the major studies that have taken place all across the world, which have seen the same thing. But now these demonstration projects in Brazil, in San Francisco, in Washington, D.C., in Canada, in the UK, all these clinics that are reporting basically the same thing, all of their participants who are using PrEP 4 or more times a week, there has not been one single seroconversion.
Known.
No, that has been seen, that has been documented. It hasn't happened. So we're not saying it can't happen. We're not saying that won't happen. I'm just saying it hasn't happened.
It hasn't.
Yeah.
Well, that's from the study side of it. Has there been any anecdotal stories of people converting when on PrEP?
Well, yes, there's always anecdotal stories. You're always going to hear those. And I'm not saying, those are important, and I'm not saying those aren't valid. But as someone who is in the education world and someone who is a consumer of PrEP, I prefer to stick with the science that's available that I
Right.
know, with the facts, because anecdotal evidence doesn't always stack up against scientific trials. And we know this even from the trials, that people always over-report things, or sometimes they say things that aren't exactly accurate of the reality.
Right.
In all of these trials, called the iPrEP trial, or the iPrEP open label extended trial, or trials called the Partners PrEP trial, or the PrEP trial that took place in Africa. In every single trial, men and women over-reported their use of Truvada. They told their doctors, yes, I'm using it 7 days a week. Yes, I'm doing it 7 days a week. But their blood plasma or dry blood spotting showed otherwise.
Okay.
So this is why I stick more to the documentable facts than the anecdotal stories.
Right.
So does that mean that PrEP is 100% effective?
We can't ever say. I would never say anything is 100% effective.
Okay.
You know, the only thing that's 100% is that living 100% will eventually result in death.
Okay. Well, yeah, that's
Right?
Yeah.
But what we know is that, again, in any of the trials and any of the demonstration projects, the research that's coming out now, with 4 or more times a week, nobody has seroconverted. No one has become HIV positive.
Great news.
Not saying it can't happen.
Right.
We're just saying it hasn't ever happened in a way that's ever been documented
Yeah.
by people that are using scientific measures to document adherence.
Wonderful.
How long after somebody begins PrEP would you say it takes to become effective? Because I know it has to go through your body. How long before you start getting on a specific regimen before you're completely, not completely, but high percentage level of protection?
Great question. According to the CDC, it's 7 days for anal sex.
Very quick.
It's 20 days for vaginal sex.
Okay.
And what also is coming out now is that we do need to understand more about how vaginal tissues process Truvada. There has been some studies with women, but not nearly enough.
Okay.
So scientists are needing to understand more about how Truvada affects women. But there are women that are using PrEP for prevention. And if you go on my page on Facebook, which is called PrEP Facts, Rethinking HIV Prevention and Sex, you'll also see there's women there that have used PrEP to conceive naturally with an HIV positive husband or an HIV positive partner. So let me just clarify what that means. Before a few years ago, if an HIV positive man and an HIV negative woman wanted to conceive a child, they would have to go through an extended and very expensive process of sperm washing that was not always effective, that was not always convenient, and it didn't always work. Now, because of PrEP, women are using PrEP to safely conceive with an HIV positive partner. And in all the instances we know about, that positive partner was also undetectable. So he's got protection on his side, she's got protection on her side, and they're conceiving children naturally. That is one of the miracles of this drug that's afforded to us now.
That's awesome. Yeah.
Okay, and which kind of brings us, you're talking about serodiscordant couples, which wants me, I want to bring this to you. In your practice, do you see a lot of serodiscordant couples, both same gender and opposite gender?
Same gender.
Same.
Usually.
What are the implications on them? Do you sometimes find that the negative person is resistant to the idea of PrEP, or?
No, I usually find that they're happy to engage in using PrEP, and that's wonderful. It's usually the positive partner that doesn't necessarily trust it as much as the science shows that it works. So that's what I'm finding in my practice.
So that's more about caring, taking care of the one you love.
Absolutely, absolutely.
Are there any unique other unique issues that come up within the discordant couples?
Well, I think more than the discordant couples is just the gay male community in general, and what it really means for PrEP to be available for them. And I find that for my negative clients, there's a lot less stigma around PrEP now than there was even a year ago, so that a lot more people now are taking PrEP and a lot more people are talking about it, and I think that speaks to the empowerment piece. And that's a really good thing, because there's really no advertising around PrEP, and so if it is spreading word of mouth throughout the community and keeping people negative, then that is a huge thing that is happening within the community, sort of from a grassroots level, right? And a lot of that started from Damon's page on Facebook, right? Where we're getting the word out, and like all of a sudden there's all these people that are telling a couple of people, and then they tell 2 friends, and all of a sudden the whole community knows. Super important.
Yeah.
And what it means to the HIV positive people is also really huge, and that is that there is less stigma now in being HIV positive because there is less rejection. People who are on PrEP are now less scared to engage in sexual activity with positive partners.
Okay.
So that's a really amazing thing that's happening as well.
And it would be really amazing to have you call us at 718-460-9802. We welcome any questions or comments. We're here until, we got about 20 minutes to go. So get these questions in because, these guys only stop by once every six or 8 months or so. And, we want to interact with you.
If it's okay, I'd like to get back to the undetectable story and talk about what that really means and what we're understanding medically what that means and what it means in terms of relationships and stigma. It came out toward the end of 2011 in a study called the HPTN 052 study, which looked at how effective someone who is HIV positive and on medication with what's called an undetectable viral load, meaning it's so suppressed it doesn't, it's under 200 copies, and the viral load is like 0, or somewhere between 0 and 200. Okay. Can individuals with a suppressed viral load transmit HIV to a negative partner? Well, the study that came out toward the end of 2011 said 96% it is not possible. It is not possible for an HIV positive person who is undetectable to transmit HIV to an HIV negative partner. This week in Vancouver, we saw that the numbers were even higher. There is no documented instance, and now this has been replicated and validated, and there were different studies that you're going to be hearing more about. There has not been a single documented infection between somebody who is HIV positive and undetectable with an HIV negative partner, whether they are on PrEP or not. And most of these studies are done with partners who are not on PrEP.
Okay.
So think about it like this. Let's say I'm an HIV negative person who's not on PrEP, and in my mind, I can stay safe by getting together with people who say that they're HIV negative. So I go out to a bar, I get on a dating app, and I'm on Grindr, and I'm like, okay, neg for neg only. But let's say that person hasn't been tested. Let's say that person who identifies as HIV negative is actually HIV positive and doesn't know it, and they're not on any medications at all, meaning they have a very detectable viral load, which is very transmittable to other people. Who is more likely to be infectious? An HIV positive partner who says, yes, I'm HIV positive, and yes, I'm undetectable, versus the HIV negative partner who says, oh, hey, don't worry, we don't have, you don't have to worry about me, I'm safe because, I'm negative. This is a totally radically different shift from what we've understood in prevention messaging. And I think it's really important people understand the difference, because an HIV person, a HIV positive person who is undetectable cannot transmit HIV according to all the studies we are seeing, especially the studies that came out in Vancouver this week. And I think you and I have seen in our work with couples what a shift that is in terms of the intimacy and breaking down the barriers to love and sex and connection that had been there before in what we call serodiscordant, or what we call magnetic couples, where one person is positive and one person is negative, right?
Yeah, I think we're seeing that in couples, and we're also seeing that across the board, where there are people now, they know this undetectable, the language now, so undetectable is a thing. And so when positive people now on Grindr can say, pos and undetectable, people know what that means, in the same way that they know what neg on PrEP means, right? So I think that's a really important thing to know. But also, I think when someone says they're negative, they're only negative as of their last test. And that could have been yesterday, but that doesn't mean that they weren't infected yesterday either. And the other thing is, when someone says that they are undetectable, that's only as of their last blood work, right? And so no one really knows what they are in this instant. So I think that that kind of language needs to really be
refined.
Yeah, refined and just taken with a bit of caution. Absolutely.
But I just want to ask you, do you think it's fair to say, in most cases, when a positive person, today, 2015, is adhering to meds consistently with our current treatments, for the most part, undetectable is pretty consistent?
Undetectable is pretty consistent, but I also don't want there to be a stigma for the people who have been on multiple regimens and are not able to get to undetectable, that there is something wrong with them, because that's not fair, right? So while undetectable sort of is the goal, just like a remission in cancer is the goal. Not everybody can achieve that. And so it's still okay to date and have sex with a person living with HIV who does not have undetectable status. But precautions can be taken, like PrEP with condoms, and you know, any number of ways like that, right?
Totally.
So that's really important to think
you.
about as well.
That's right.
Yeah.
Now, when someone is HIV positive and their viral load is undetectable, is that from years of, you know, aggressive treatment, or is that just like a different strain of a less aggressive, like, strain of HIV?
Well,
Well, treatment can take effect in weeks, months, years. It's different for the individual. That's my understanding.
Right.
what the scientists were saying this week and what they've been saying over the 4 years, but now, especially now, is that the sooner someone finds out they're positive, the sooner they begin treatment, the more success they're going to have.
Okay.
It used to be kind of a wait and see approach. Now it's like hit hard, because as soon as somebody, they start treatment earlier, they are more likely to become undetectable faster. And then that strain of HIV will stay suppressed.
I don't know if you saw it this past week. There was a woman with HIV. It was just like maybe yesterday, so I don't have a lot of information about it. I saw it. There was a woman with HIV who, when she was born with it, very young, doctors started slamming her with medication, and then they noticed that now she doesn't take any medication anymore, and the virus is still undetectable after like 10 years of being off the meds. Are we starting to see more cases like that with, you know, people who hit it hard when they first, you know, find out they're positive?
I saw that too. That was amazing.
Yeah.
As far as adults, that is not a common occurrence.
Okay.
I think it's really important that we learn from that when we see that in children, and that has happened in children. In adults, I have yet to see that happen, or I think there hasn't really been a lot of scientific evidence for that.
Not that I'm aware of.
Okay.
No. But I mean, it's like what happened in the mid-90s, right? When protease inhibitors came out. So everybody, up until that point, there were really no effective medications. People were using AZT, and it was not a good situation. And then protease inhibitors came out, which is a class of medications. And so they would use that in combination with AZT and other things. And all of a sudden, people's viral loads went way down, and people who were really on their deathbeds were up and like walking around and being productive. And so that's sort of where all of that started from.
Okay.
And it continues today. So I feel like, you know, it's definitely a conversation to have with your doctor, whether you are ready to start taking medication, what medication is right for you. But I think that the most important thing is to try and get, if you're living with HIV, to try and get your viral load as low as possible. Because the closer to undetectable you get, the less chance of transmission that you're able to have, right? So it's super important.
Right. In your guys' professional opinion, how far are we away from making an HIV positive person? How far are we away from extracting the virus?
From like a cure?
From like a cure.
Oh, wow.
Professional, what have you guys seen? Because I know you're traveling all over doing research. You work extensively with people with HIV. Like, what are you hearing from like personal points of view? What are you hearing from medical points of view? I know it's like really something to like.
Yeah, well, as of now, it's only happened once.
Yes.
It's happened with one individual named Timothy Brown, who is beautiful. He was there this week, and just beautiful, wonderful, fun guy. I know the doctors are trying to learn from him, but I think at best, unfortunately, we are at least a decade or more away. And yeah, I'd love to be wrong about that.
I don't know. I'm a little bit more skeptical than that. I don't know if there is going to be a cure. Maybe a functional cure are the things that we have now to keep the virus in check, to get the viral load as low as possible. And I think that that is, in effect, a functional cure, especially if we're talking about people's immune systems functioning at a normal level and unable to transmit the virus. I mean, like, what's better than that? Right. And I did actually bring a pill with me today that is not PrEP, but is a medication that people living with HIV can take, and this is called Complera. So it's just one of the pills, right, that is available for people to take. And it is a It's 3 pills in one, so it's a combination unto itself. And I think Truvada is actually in there.
It is.
Truvada looks like that, except Truvada is blue.
And this is once a day.
Once a day. Yep. And that's it. So there's the potential for someone who is living with HIV, whether they are diagnosed today or whether they were diagnosed 10 years ago or 20 years ago, to be able to take something like this, if that's indicated.
And think about it, like you were saying, I don't know if we're going to have a cure either, but if we are able to help people who are positive get access to treatment and get their viral load suppressed, which means medical providers not being stigmatizing or judgmental, if we could get people at risk for HIV who are HIV negative and ask them to consider using PrEP on a consistent basis during the, quote, seasons of risk, during the times in their lives when they could be at risk for HIV, we may see an eradication of this sooner. And actually, Governor Cuomo has called upon New Yorkers to do this as part of his plan to end HIV by 2020. That involves testing for everybody who wants it. That involves access to treatment medications for everybody, and access to PrEP for everyone who could be at risk for HIV. And if we do that, we will end new infections in HIV by the year 2020. It's extremely ambitious for him, and no one has ever really called upon a state to do this before. But he's got a pretty solid plan, and I think it's totally feasible. I think we could do it sooner than 2020. But 2020 is what we're going for. And what we're aiming for. So it is possible, and I think it's more likely we're going to see HIV eradicate through these strategies versus a functional cure or a functional vaccine.
I think, though, that there is still so much stigma around in the community that my clients that are living with HIV are scared to really go on the app sometimes or go out to a bar. And it's really a huge fear of disclosure, you know, and then rejection. And it's happened to a lot of people, and it continues to happen. And I think that that is really like trauma happening over and over again, right? You get your diagnosis, that's traumatic. And then you try and meet someone and form friendships and a social community, and you get rejected. And so where do you go from there, right? So that can be really hard. And that doesn't happen with everyone, but that does happen with a lot of people. And so I think that something needs to be said for that too, and the language that is still in the ads that people see on Grindr and stuff, like neg UB2 and only looking for negative people and stuff like that.
Which, as we pointed out, is the worst way to stay HIV negative.
What about the word clean?
Clean, right? Clean, meaning people living with HIV are dirty, right? That's what people living with HIV hear.
Right.
If I'm not clean, then I'm dirty. That's not
No,
fair.
and it's not. And in such a social community, you shouldn't have to hear those words and base, new potential friendships just because you're afraid of being stigmatized.
Right.
Back to you really quick. Can you just go into, I've never heard of the term high risk season. What is that real
Seasons
quick?
of risk.
Yeah, it's seasons of risk.
That's
yes.
okay. That was a term coined by Dr. Bob Grant, who was the principal investigator on iPrex. And iPrex was the very first trial that gave us the information that we have today. There's been many others, but that was the first. He calls it seasons of risk, and we all want to get together and sing seasons of risk when he says this. But what he meant to say, what he articulates, is that there are times in our lives when we might go through phases. I call it slut phases. And times in our lives when we're sexually active with multiple partners, when we might be more at risk for HIV. And like I said earlier, there are times in our lives where we may not be actively having sex, or we may only be with one partner who's undetectable or who's HIV negative. We may not need to take a pill to stay HIV negative. So that's what he means by seasons of risk.
Okay.
It's a reminder, it's a way to remind that choosing to use Truvada as PrEP is not a lifelong commitment. It doesn't have to be. It's summertime right now, so a lot of people are running around, they're traveling, they're going to Fire Island, they're doing a lot of things that they don't normally do throughout the year. PrEP is an absolutely appropriate strategy for that. If I'm sexually active only in the summertime and then, come back to New York and then I just, I don't have sex that much, or I'm a student and I really don't do very much, that is an appropriate use of PrEP. The most important part of this, the most important part of whether someone's going to start and stop, is that they do so with a medical provider. And that cannot be emphasized strong enough. All the critics, all the concerns, all the anger that people have about PrEP, this is the one thing that I do agree with about their concerns and their critiques. It is so imperative that if someone's going to begin using PrEP or restart after they've stopped, that they verify that they are actually HIV negative with a primary care physician. The reason for that being, and you asked about resistance earlier, the only times that anyone has become resistant to Truvada in any of these studies is when they were already HIV positive and did not know it. And they were using Truvada by itself. As Scott pointed out, Truvada is used for treatment in combination with other meds. So if an HIV positive person uses Truvada by itself without other meds, it not only will not suppress the viral load, but that viral load will overcome it and become resistant to it. That is what has happened when people have used PrEP either on their own or they were not verified as HIV negative before they started. So all the concerns, and if people only remember one thing from this, if you are HIV negative and want to start PrEP, make sure you are tested by a doctor, nurse, or physician's assistant first. It's okay to start, it's okay to stop, just do not restart without a doctor.
And so 2 things on that. So with PrEP, it's true, you can start and stop as you wish under a doctor's guidance. Yes. And I definitely have clients that are doing that, actually. This summer they're taking it, and they're not going to, well, they're not planning to continue to take it in the fall after this season. But also, just to make sure that everyone knows the difference, that if you're living with HIV, you can't start and stop HIV meds, right? That would be not a good thing.
I mean, back in the day, I used to read about people taking med holidays, and that's not the case anymore.
That is not advisable.
No, that's not a good thing. And always, always ask your doctor. Right? Always work with your doctor when you're talking about any kind of medications. And another thing I wanted to mention about PrEP that's really interesting is that some of my clients are actually using PrEP not only for HIV prevention, but also almost as an anti-anxiety medication, because there is such a fear of contracting HIV, and what will this do to me, and what will this do to my life, and nobody will want me anymore, and there's a huge fear around that. And when people can take PrEP and have faith in PrEP that it actually works, there is less fear around that. And I've heard from 2 people this week, one a friend and another a client, that were able to experience sex in a way, they're both on PrEP, they're able to experience sex in a way that they never have been able to before, really able to enjoy themselves. And that was a beautiful thing, because why shouldn't everyone be able to enjoy their sex lives to the fullest?
Yes.
That's what it's there for, pleasure. And to make babies, but pleasure. On this panel, pleasure.
Yes. Yes, it's pleasure. And like I said earlier, I've been on it 4 years and 4 days. I'm sad to say I've not been having sex every day for 4 years and 4 days, but I also use it. Well, because I do kind of still run a therapy practice and do write a book every now and then, so I've got some other stuff going on I got to be busy for. But I still have continued to maintain use of it, even during periods over the last 4 years and 4 days where I've not been sexually active, because it does afford me that peace of mind, because I'm interacting with the world just knowing at this moment I have protection, no matter what.
Yeah, and now think also about when people get infected and how people get infected, right? So there are times when partners cheat. And when partners cheat, they might contract HIV. So maybe somebody does want to use PrEP for a long time. Maybe the idea is, hey, we're in a committed relationship, great. But we've heard so much about people cheating and not knowing about it and then finding out later. Why not be able to have sex the way they want to have sex and still be protected using PrEP?
And like you said, there's a bunch of like traumatic steps that just like keep on happening. I know the majority of the people I know, that's the way they contracted HIV. Very trusting, thought they were one-on-one in a relationship. Somebody goes out of that relationship, and the person you trusted is the person bringing it home.
Absolutely.
So, I mean, yeah.
Well, and again, according to Patrick Sullivan, formerly of the CDC, that most new infections in America at this point between men occur in the context of what's called a main relationship. This is a study that came out a few years ago. And so if you're talking about actually practicing safer sex strategies and risk reduction, it's important, and I think this is the work you do so well, and I seek to do with couples, is to engage realistic conversations about sexual desire with partners outside of the main relationship, and to facilitate these conversations without a sense of guilt or shame or using the word should, but to engage these conversations with integrity and with love and with honor for one another, to say the reality is that if we're going to stay together together for any long period of time, one or both of us is going to be attracted to other people at some point. And this does not have to be the end of the relationship, but it could be the end of the relationship if we have agreements that we break.
Yeah.
So why don't we create some agreements that we can both stick to, so that will reduce our risk and really protect the integrity and fabric of our relationship.
Absolutely. Make those boundaries and those rules for your own relationship. Don't follow anyone else's.
Yeah. Have integrity. That's really my thing. I wish, you know, every year during Pride, I was like, I think Pride is great, and I'm all for the Pride Parade, but I really wish we could have an integrity parade. I think at this point, we could have both. I think we need an integrity parade. I think everybody in this country needs some help with this, but especially the gay community could really use some help with integrity, meaning having your actions follow your stated values, so you don't say one thing and do another on a consistent basis. And if people were to do that more often, I think we would have much happier relationships, a lot less riskier health issues going on, and much better communication and love.
Yeah, I've seen it in some of the more spirited debates on your message board on your Facebook.
PrEP Facts, Rethinking HIV Prevention and Sex on Facebook. Join us.
It's excellent.
Yes.
It really is. It's
but
a
yes,
wealth
the
of
spirited
information.
discussions about.
Yes, I mean, you know, all sides of the issue. You know, some people do get very passionate about some irrational thoughts that we've discussed throughout tonight's show, but in the end, it's a tremendous resource.
Thank you. Thank you for that.
It really is.
Thank you for that. You know, I started this a couple years ago just because at that time, my perception in New York was that we were so behind in education. The agencies, the organizations, the Department of Health would not talk about PrEP with their consumers who were at risk. And so I was like, I can't really do much about them, but what I can do, if they're not going to talk about this, is use social media to get the word out. And just thinking, okay, maybe some friends in New York will be interested, or maybe people around the country, but you know, a few people might want to drop in. We now have over 7,500 international members that are on there literally 24/7, having discussions and asking questions and stating concerns and having the kind of discussions we're having here about resistance and adherence and science and all
You're
these
on there,
things.
right? No?
You will be at the end of this. You'll be on there. If you're on Facebook, we'll make sure you're on
It's funny. In preparation for the show, as I asked him if he was on PrEP, and he said, nobody wants me enough for me to...
No, I don't
That
have
can't be
sex
true.
nearly enough to be on PrEP. But like you said, you know, it's like a precautionary thing. I would personally take it just for the peace of mind, just in case a night does happen where I should slip up. That's why I would take it. But you know I'm not sexually active, and you know, you just.
Well, if you'd like to be, where can people find you?
We
We have a few seconds
on the
left.
corner of Flushing Ave. No, Monday night, this coming Monday, Stand Up New York, 8 and 10 p.m. Great comedy club, Upper West Side.
And your website?
DamonLJacobs.com. Don't forget the L. DamonLJacobs.com.
And Scott, yours?
Scott A. Kramer, Kramer.com.
Don't forget the A. Scott A. Kramer.
As always, our time goes so fast, and I do want to thank you so much for being here. Yes, always. Sorry, husband. And I want to thank you for joining us. I want to thank you for guest hosting. Carl will be back. We got a really special show on July 31st, 2 hours, 7 to 9 p.m. right here on this channel, our 20th anniversary show. Watch us, and we will see you then, and we will see you next time.